This is Jack and Koito's hand, and this is Fred here. Fred is rather skinny, and what I'm wanting to do with Fred is show you a few things about the body. What we're talking about mostly has to do with women's low back pain, which is fairly common, especially women that have given birth to children, especially after they're maybe in their 50s and 60s. So the first thing that I want to show you is that the spine, I'm turning it sideways so you can see, there's basically four curves to the spine. This curve here, this is called the thoracic curve. This curve right here is called the lumbar curve. And then the last curve is this curve, which is the pelvis and the sacrum. And so what I'm going to show you now is the places that are difficult, primarily for women. And the first thing is that very often they have low back pain. And the low back pain is usually here, right in this is the lumbar spine, just above their waist. They'll feel pain on one side or the other side. If you actually, and once again, if this is your mother or your grandmother, you can feel here with your hand, and you'll feel one side is tight as compared to the other side. That's the side where they have the pain. Almost universally, that tightness and the pain come together in the same package. And then what you want to do, and I'm going to demonstrate this on Koito, what you want to do is kind of tap that area on both sides so that your relative, your mother, your grandmother, knows exactly where you're feeling the tightness, and you can make sure that she says, yeah, that's exactly where I feel the pain. So that's the first step. The second step is how to release the pain. And I'm going to talk about one part of the pelvis here, which is really important in terms of releasing the pain. You have a bone here, and you have a bone here, and then you have a bone right here. This is called the sacrum. This is called the ilium. And what happens especially for women, I'm going to come closer so you can see, is these are ligaments that hold those bones together to the sacrum. And what happens is when a woman delivers a baby, these bones have to expand. The ligaments have to expand and stretch so that there's more room for the baby to come down and be delivered through the lower abdomen. And what's happening is after those ligaments expand, the pelvis needs to return to its original shape, which for most women it does return to its original shape. But what happens underneath is some of these ligaments do not return to their strength. And especially as someone gets to middle age or a little bit older, one side or the other, those ligaments get soft. And so what happens is when those ligaments get soft is the muscle above the soft ligaments has to be tight to hold everything together. And that's why they have low back pain. So what we're going to do is we're going to demonstrate with Koito how to help them release that pain. So you can see this part of her back, okay? So this is the top of the pelvis right here. This is where the muscles are, and I'm just going to feel one side and then the other side. And actually this side, her left side, is a little tighter than the other side. Do you notice that as well, Koito?
Yes.
Okay, this is a little bit tighter. Mm-hmm. So what I'm going to do now is I'm going to come down to her pelvis, and here's the sacrum is right here. This is called the SI joint on both sides, and that's the joint between the ilium, this bone here, and the sacrum, this bone here. And what you'll find is that the place where the muscle here is tighter corresponds with the place where the ligaments are not holding these two bones together the way they should. So what I'm going to do is I'm going to have Koito breathe into my hands. And as she exhales, I'm going to actually rotate with my right hand. I'm going to rotate the left side of her pelvis over her sacrum. And as she exhales, I open like this.
When I'm inhaling, you open.
Okay, she's inhaling, sorry. And as she exhales, I compress once again over the ilium with the sacrum with the ilium. And then I'm just going to come up here and I'm going to check the tonus of these muscles. And this one is pretty much like this one now. It's very, very even. Koito doesn't have much low back pain, am I right? She doesn't. So, but what's happening, even with somebody who doesn't have low back pain, when you find that area where the muscle is tight, and you rotate over, that muscle will start to soften. Then, just like we did with the arm and with the shoulder and so on, I'm just going to tap that muscle. There's soft tissue here above the muscle, and you'll notice as you get closer to the spine, that's where the muscle usually is tighter. We're going to do one bit more. So I'm going to have Koito breathe into my hands. And as she exhales, I'm going to take that corner and compress it towards her spine, just like that. Very gentle. Almost no pressure at all. She breathes in again. I'm opening with my hands. And one more time, we compress over, like so. Okay, I'm holding, and then I release for Koito. And we're going to have Koito turn around and face you guys and tell you what she feels.
Feel more even between right and left. Also, if I move, left side is easier to move now.
All right. So this is our third little video for this unit. Because we are teaching a class that's coming up this coming week, this is part of the reason we wanted to demonstrate those ways of working with tightness in the body. So I hope you have a good time. I hope you enjoy the videos. We're having a good time, right, Koito? Yeah, more or less. There we go. So sayonara. See you next time.